You ever get one of those strange nagging aches in your leg and you just wonder, what is actually going on under the skin? It's one of those little mysteries our bodies like to throw at us, right? Well, today we're going to solve it. We're about to take a deep dive into the incredible circulatory superhighway that's running through you right now, and we're going to find out exactly what happens when there's a traffic jam. So yeah, it really just starts with that one simple question. You notice some swelling, maybe a feeling of heaviness, and it's usually just in one leg. What is your body trying to tell you? Well, to get the answer, we need to take a look at the brilliant and kind of complex plumbing system that keeps all of us going every single day. And that brings us right here to your body's return system. Okay, think of that like this. Your arteries are basically the delivery trucks, pushing all that oxygen-rich blood out to every part of your body. But how does all that blood get back to the heart to start the trip all over again? That's where this incredible hidden network comes into play. Now, this return system is really made up of two key players. You've got your venous system and your lymphatic system. The veins, they're in charge of bringing blood back to central command, your heart. And the lymphatics, think of them as the cleanup crew, clearing out any excess fluid that gets left behind. So, here's the bottom line. When you see swelling, it's a sign that there's an interruption, a backup, somewhere along this return journey. But let's break that down, because not all veins are created equal. You've got the main highways. These are your deep veins. They're buried way down inside your muscles, doing all the heavy lifting, carrying most of the blood. And then you have the side roads, the superficial veins. They're much closer to the skin, just collecting blood from the surface. Now, remembering this difference between the main highway and the side roads, that is absolutely key to understanding the different kinds of traffic jams we're going to talk about. And we can't forget the unsung heroes here, the drainage system. The lymphatic vessels run right alongside the veins, and they're basically mopping up any extra fluid in your tissues that the veins didn't grab. They are critical for keeping everything in balance. So now that we've got the map, the highways, the side roads, and the drainage system, let's look at what happens when our first big problem shows up. Okay, so what happens when a major roadblock, a total traffic jam, forms on one of those deep vein highways? This is where we run into our first and most serious issue, deep vein thrombosis, or as you probably heard it, DVT. A DVT is pretty much exactly what it sounds like. It's a blood clot, also called a thrombus, that has formed in one of those deep vein highways we just talked about. This clot can act like a dam, and it can partially or even completely block the blood from flowing back to the heart, which, as you can imagine, causes some serious backup problems downstream. So how would you even know this is happening? Well, the body sends out some pretty classic signals. First, the swelling is almost always unilateral. That just means it's in one leg, not both. The pain isn't usually sharp. It's more of a deep, aching discomfort, a feeling of fullness or heaviness. And here's a big clue. It gets worse when you're standing or walking, but it feels better if you put your leg up. And a little fun fact from the research, for some anatomical reasons, it's actually the left leg that gets affected more often. Now, because these symptoms can be a little vague, doctors don't just guess. They use a systematic approach, something like the Wells criteria you see here. They look for risk factors, like if you've had recent surgery or haven't been moving around, and they look for objective signs, like if one calf is significantly more swollen than the other. Now, this is not for diagnosing yourself, of course, but it's a really cool peek into how clinicians logically narrow down the possibilities to figure out if that traffic jam is likely a DVT. All right, let's shift gears. We're moving away from a total blockage on the main highway to a totally different kind of problem on those surface-level side roads. This one isn't about a clot. It's about a mechanical failure. What happens when the little one-way gates that are supposed to keep blood moving forward just stop working right? You know, the engineering in our bodies is just beautiful, and this is a perfect example. As your muscles squeeze and push blood up through your veins, these tiny one-way valves pop open to let the blood pass through. Then, when the muscle relaxes, gravity naturally tries to pull that blood back down, but snap, these valves slam shut, stopping it cold. It's a perfect little system for fighting gravity. So the trouble starts when these valves get weak and become what doctors call incompetent. Basically, they don't seal properly anymore, and that means blood can leak backward and start to pool in those superficial veins. Over time, all that back pressure causes the veins to stretch out, to bulge, and become what we all recognize as varicose veins. And the feeling is really different from a DVT. This quote from the source material just nails it. The discomfort is more of a burning or throbbing feeling, and it's usually right over those bulging veins. But just like with a DVT, putting your leg up helps because you're giving gravity a hand and getting that pooled blood moving again. Okay, we've talked about a blood clot blockage, and we've talked about leaky blood valves. Now let's turn to our third and final culprit. And this one has nothing to do with the veins at all. This is what happens when the body's essential drainage and cleanup system, the lymphatics, gets overwhelmed or blocked. This is lymphedema. At its core, lymphedema is a fluid backup problem. It happens when that lymphatic system we talked about, that network of vessels that clears away extra fluid, is obstructed or damaged. So instead of blood pooling, you get a buildup of this protein-rich fluid called lymph right in your tissues. Now, here is a really key physical clue that helps tell this apart from vein problems. Swelling from lymphedema usually starts at the far end of the limb, meaning it often begins right in the foot. And here's the crucial part. It almost never spares the toes. The swelling involves the whole foot, toes included right from the start. And this is a perfect illustration of one of the classic clinical tests for it. It's called the stemmer sign. It's actually really simple. A doctor will try to gently pinch and lift the skin on top of the foot right at the base of the second toe. If that skin has gotten thick and they can't lift up a little fold, that's a very, very strong sign that the real issue is lymphedema, not a problem with the veins. So let's just put these two side by side to make it super clear. On one hand, you have venous swelling. That's a blood backflow problem. It often gets better if you put your leg up. On the other hand, you have lymphedema. That's a backup in the fluid drainage system, and its calling card is that persistent swelling that almost always includes the whole foot, toes and all. Okay, we have covered a lot of ground. We've talked about the deep highway, the superficial side roads, and the all-important drainage system. So let's put all these pieces together and decode what your body might be trying to tell you. This table right here is a fantastic summary. Think of it as your cheat sheet. DVT? That's a clot in the deep veins, the main highway, and it causes sudden one-sided swelling. Varicose veins? That's from leaky valves in the superficial veins, the side roads, giving you those visible bulges and a throbbing ache. And lymphedema? That's a failure of the lymphatic drainage system, leading to that persistent swelling that takes over the toes. 3 different systems, 3 very different problems. So really, the main point of this whole explainer is this. Understanding the why behind a symptom is incredibly empowering. This isn't about diagnosing yourself at home, not at all. It's about being an informed, educated partner in your own health and being able to recognize when a symptom is a signal that it's time to go get some real answers from a professional. You know, that ache, that swelling, that feeling of heaviness, it's not just random noise, it's data. It's your body's sophisticated communication system sending you a message. The only question is, are you listening?